This is an informational video which introduces EMTrack, a secure web-based patient tracking and hospital evacuation management system. This video is one of 4 in a series about the secure Oregon Health Alert Network system. Your agency or facility may use one or more components of the Health Alert Network, or HAN. The web application EMTrack is a modular add-on used in conjunction with HOSCAP. Depending upon your trauma region, use of EMTrack will differ. As of March 2010, EMTrack is only released in Oregon Trauma Region 1. It is used in major cities and states across the U.S. The objective of this video is to introduce the core operational concepts of EMTrack in the field and in the healthcare system. Users of EMTrack are required to view this video before attending online training. Level of interaction with EMTrack is dependent on job function. This video will demonstrate both field use and facility use of EMTrack. 911 centers may also need to monitor EMTrack. This informational video was made possible with funding from the U.S. Centers for Disease Control and Prevention and the U.S. Department of Health and Human Services. It was produced in partnership with Oregon Health and Sciences University, Dornbecker Children's Hospital, Tuality Healthcare, AMR, Metro West Ambulance, and LifeFlight. This video was produced by the Oregon Health Authority and the Department of Human Services. Use of EMTrack during a mass casualty incident, or MCI, helps to ensure the healthcare delivery system efficiently manages patient care from scene to hospital and from hospital to hospital, including ground-to-air transport. The goal of EMTrack is to track patients in the trauma system during surge events. EMTrack is used in conjunction with HOSCAP based on the commercial software EMResource. An EMResource video overview is also available online. The remainder of this video will demonstrate the use of EMTrack in response to a motor vehicle MCI. Although EMTrack has additional modules to manage hospital evacuations, the scenario which follows will demonstrate the use of EMTrack for pediatric patients and their transfers. The scenario is fictional. Facility transfers are notional. EMTrack would also be used if Oregon were to receive evacuees and patients from disasters in other states. MCI events require swift response and coordination. Examples include multi-vehicle accidents, commercial air disasters, industrial accidents, shootings, structural failures, major fires, severe weather events, earthquakes, and major chemical spills. Tracking during such incidents ensures patient loads are appropriately distributed within the trauma system, given current capacity. It also ensures family reunification for the elderly, pediatric, and unconscious patients. After an MCI has occurred, a local authority, which may include a 911 center or regional hospital, will log the incident in EMTrack. All patients will be tracked against this incident until closed. The system will uniquely track all patient transfers until the patient is admitted and stabilized at a hospital, unless the patient has expired. Triage tags with barcodes and unique identifiers will route patients through the system. Access to EMTrack will vary by user and job function. Different users have different views. Some users may have full access to enter, add, and edit patients. Others may be view-only. Specifics about login and access will be reviewed in an on-site training. Online training is also available. The remainder of this video will demonstrate the steps included to properly manage patient transfers following a fictional MCI with 2 patients. Facility names, ambulance companies, and unit numbers are all notional. Patient X, a 3-month-old female, red, and Patient Y, a 5-year-old female, yellow, are in transit to 2 different facilities. Air transport has been called for the Patient X, triage red. Ground transport for Patient Y is en route to the scene. Both X and Y are 2 of the 11 patients in this Washington County scenario. The other 9 would be tracked using similar protocol. The scenario uses regional hospital for incident coordination and patient transfers. Metro West Unit 999 is on scene for transport. Using a handheld wireless device, both patients are entered into the system. Alternatively, units using laptops or toughbooks loaded with EMTrack Mobile can also upload information into EMTrack Web. After contacting Regional Hospital, Patient Y is routed to Tuality Hillsboro and Patient X is routed to Dornbecker Children's Hospital. On scene, information is updated into the handheld device. Alternatively, patients can be entered as shown here directly into EMTrack without scanners. Upon initial entry into EMTrack, only basic information is captured, including but not limited to approximate age, sex, and triage category. Other information can be added later following arrival at the destination facility. Because both patients are logged in EMTrack, situational awareness about patient location and distribution is maintained. Because all facilities responded to an all-call and updated their red, yellow, and green capacities, Regional Hospital can appropriately assign patients. The facility's HOSCAP computer terminal notifies the ED of the incoming patient or patients. As the receiving facilities await the arrival of patients, additional all-calls may be necessary to ensure Regional Hospital has up-to-the-minute capacity data. An example of a major surge would be a commercial air disaster, where potentially dozens of patients would need triage and transport. Patient X is airlifted to Dornbecker Children's Hospital. The patient is scanned upon arrival at the helipad and again rescanned upon arrival in the emergency department. Patient Y is in transit to Tuolity. Upon arrival at the Tuolity ED, the patient is stabilized and rescanned. Both patients' locations are known at all times. Patient Y's mother has arrived at Tuolity after confirming the location of her child. The attending physician determines patient Y should be transferred to Legacy Emmanuel Children's Hospital. The patient is then rescanned as en route to Legacy Emmanuel. This Portland Metro scenario uses both ground and air transport. In extreme cases, any transportation method would still require patients to be entered into EMTrack. In an emergency, the state of Oregon may offer mutual aid, accepting patients from other regions of the country and require use of EMTrack. As EMTrack is implemented in Trauma Region 1, EMS and hospital stakeholders play a critical role in ensuring business rules are consistently applied during an incident. Deviation from standard operating protocol undermines the effectiveness of the system. This introductory video should be followed by an on-site system configuration and training. For exercises, all incidents and information entered shall be clearly labeled exercise or drill. If your facility uses HAN and/or HOSCAP, it is strongly recommended that the video overviews of these two related systems are also reviewed in conjunction with this video. Use of EMTrack and HAN or their supported systems without authority or in excess of authority is subject to prosecution. Unauthorized access is strictly prohibited. This video was produced for the Oregon Health Authority and the Oregon Department of Human Services by T. Scott Media.